Okay, everybody. Thank you all for joining. This is an exciting opportunity to share what we've been working on for well over a year in terms of our strategic plan for the next 5 years. So again, Elena Craft joined HEI in August of last year, and just cannot tell you enough about how wonderful the staff are and the work that you'll see and the work that's proposed over the next 5 years. So we're really looking forward to your feedback and your thoughts on the individual components and programs. Just a little bit in terms of our work at HEI. The overall mission, of course, is to inform decisions that foster a healthier environment and better health for all. And that really, the crux of that is on the impartial science. That at our core is what we do, is we invest and we provide that impartial science that's used in decision making. Now, we spent a lot of time on the illustration that you see on the right. That's probably going to be adjusted. I think, really what we're trying to convey here is that we have individual programs. We have the core program that has traditionally focused on transportation and health, energy and health, of course, our global health initiatives, and then our overarching work in terms of reducing inequities across all of the different portfolios that we have. And then a key part of what we do is communicating the science that we fund in a way so that it is able to be used in the policy and decision-making context. And as scientists, I think we struggle with that a lot, right? How do you convey all the nuance of a particular study or the findings of a complicated body of work in a way that you can explain to a general audience? And I think we do that very well, and that's why you see the impact that HEI has had over the years. So how we achieve the mission is really about funding and supporting policy-relevant scientific research. And tomorrow, we're going to have a session explicitly talking about how our investigators are able to do the work in a way that makes it easier for that science to be used in the decision and policy-making context. That's something that's of key interest to EPA, obviously, to other regulatory agencies, and thinking about how can we do science in the best way to get what we need from it. Obviously, as many of you are here today, have served in some role or capacity as part of a committee that oversees and reviews the scientific research that's being conducted. I think I myself have seen this over the course of my career, that the traditional peer-reviewed process is waning a bit, frankly. I can't say that there's the same rigor and robustness to that process that has always existed. And so one key part of the HEI model is that oversight and making sure that the research that we fund and that gets produced, that's in the reports, that's being used in that policy and decision-making context is essentially bulletproof, right? It has been vetted by the top minds. It's the best science that we can produce with the work that we have. We're also a convener. As you know, we have government, industry, NGOs, academia, and community members here. And they're all informing the work that is being funded, the research that we do, because we want to make it relevant. This research, another benefit of HEI's work is that we're able to be nimble in ways that other agencies are not. We're able to understand and fund work that is relevant in the moment. And I think that's a key part of what we do. And then obviously synthesizing, interpreting, and communicating that scientific evidence. I guess a most recent example is a traffic review study that we completed just recently. That's an example of something where we're synthesizing a lot of work, a lot of research on a particular topic, looking at emissions within the transportation sector, and really pulling out what are the key themes, what are the nuggets that are most relevant in terms of the policy and decision-making context, and then engaging, again, with audiences to facilitate the use of that science. So just in terms of our individual programs, again, environment and health, this has been our traditional core work. For 40 years, this has been the program that has provided the science on exposures and health effects of air pollution, funded jointly by EPA and the motor vehicle industry. Another key element of HEI is that balanced funding. We hold that in such high regard because everyone has a stake in the work that we do, and the point of it is to produce the very best work that we can. Global health initiatives. This work is a newer part of the HEI portfolio, but looking to build capacity in low and middle income countries to strengthen awareness of pollution issues regionally around the world, funded by philanthropies and development agencies. There is value in being able to support this work in other places, and there's value to us here. And then, of course, as the world is decarbonizing, what are the health implications of that energy transition? So thinking about defining community exposures, cumulative impacts of energy development. There's just a ton of work in this area. Obviously, with the hydrogen hubs, there's lots of funding coming down from government agencies to support the development of these technologies. And so thinking about how do we avoid unintended consequences of building out these huge infrastructure projects and ensuring that we're protecting communities. This is funded jointly, again, by EPA and the oil and gas industry, with many of those representatives here today. Now, how does HEI's model work? Well, again, we have this public-private sector partnership. We're coming together, like at events like the annual conference, like our sponsor meetings, like the visits that I do, our senior staff does over the course of the year, to learn about what are the priority areas for our sponsors in terms of the work that they see as being most relevant to them. And so we take that information, we identify those research priorities, and that's where the sponsor involvement ends. That's how we are doing our work in this impartial way, is that our sponsors are informing those research priorities, and then our staff and our committees are taking that work and they're selecting the research that gets funded, and then they oversee that research throughout the course of the investigator's report. Now, you can talk with some of our investigators, many of whom are here, and they will tell you it is the most rigorous process that they participate in terms of the type of reporting that has to be done. And that's by design. We have that robustness for a reason, because when we are, defending the science that we fund in all areas at the highest levels of criticism, we are certain that we have funded the very best work and that we have overseen it in a way that is as rigorous as it can possibly be. Yes, it's onerous, and that's part of the process. And then, the research committee and the review committee obviously have the role of ensuring the work along the way. So they're constantly getting reports, reviewing reports from investigators, and making comments. Why did you do it this way? What does this model mean? The whole soup to nuts. And then the board of directors, many of our board members are here for the conference. I hope you have a chance to meet them. Just really masters in their field, and they oversee the implementation of this model. And then engagement. Once the work is done, once it's out there, once the reports are written, we go out and we share that information in ways that are useful. Recently, we released a video from our State of Global Air work, focusing on children's health with regard to air pollution. That's something that now regional governments around the world are using to help explain the health effects of air pollution in different areas. And it's a key tool and resource that we've made available. So again, it's the publications, it's the synthesis of the knowledge, public engagement, the scientific communication, and then that science policy translation that I think provides, it's weaved together in a way that takes us full circle from the very beginnings of an idea for a project or proposal to the very end where we've got the results and we see how they're implemented. I'd like to turn it over to Dr. Ellen Mantus, who is our Director of Science. Ellen comes to us, she's been here several years now, but from National Academy of Sciences. And, you know, again, I think as you'll see throughout our work, our staff are just impeccably trained and have impeccable expertise in their areas, and it's just been a great joy to be part of this team. So thank you very much for being here. I'll turn it over to Ellen.
So I'm going to take you on a whirlwind tour of some highlights and start the highlights of what we've been working on this past year. So just to remind everyone about what the current strategic plan has, we had 4 key themes. Accountability, again, that's just talking about the effectiveness and investigating the effectiveness of policies. The second one is complex questions for the air pollution mixture. The third is transport and urban health, and our final one is global health. And there were a number of cross-cutting issues across all these themes that are listed on the bottom of the slide. So as far as accountability goes, we have 3 reports that are almost out the door. So you should be seeing these 3 reports in the next couple of months. One is comparing the student health and performance in school districts with and without programs to replace or retrofit diesel school buses. Another is quantifying the monetized societal health benefits associated with emission reductions in major sectors, basically the transportation and energy production in Canada and the US. And a final one that is evaluating changes in emissions from Texas policies to curb those emissions and its relationship with birth outcomes. There are a couple other studies that are also in this accountability area, 2 of which are also wrapping up and are in the review process or soon to be, and they are looking at policies in China that are meant to reduce emissions and looking at the association of those reductions with various outcomes. Another one that is also in the finish line here is also comparing effects of policies targeting mobile vehicles and electricity generating units to improve air quality and estimating their health benefits associated with those reductions. And one that's in progress right now that's developing U.S. national fine scale and daily PM2.5 source emission impact estimates and their uncertainties. In the area of complex questions on air pollution mixtures, we have 5 studies actually in the review process, and they will start being published shortly that are looking at strategies for enhancing exposure assessment and quantifying influence of exposure measurement error. I think you're getting the impression that we're keeping our review committee quite busy right now. So 2 other studies that harken back to what we were discussing yesterday on the influence of biomass burning, both wildland fires and prescribed burns, on various health effects. Another area of this theme was when we funded a number of studies looking at the relationship between COVID-19, air pollution, and health. We published one of those studies in November by Zorana Anderson and her team, who were evaluating the association between exposure to outdoor air pollution and the risk of COVID-19 incidents, hospitalization, and mortality in a large Danish cohort. And they found elevated risk of all 3 outcomes associated with fine and coarse PM, black carbon, and nitrogen dioxide. And the 4 other studies in this area are also wrapping up, and they are also in the review process. So we have lots of things about to be in the process of being published. In the transportation and health area, we published a study in January by Josh Apte evaluating the use of mobile monitoring, and he was looking at this in 2 different locations. And they found that they could produce relatively reproducible maps of traffic-related air pollution data from few repeated drive passes in both locations. There are 3 other studies in this area that are looking at the relationship between traffic-related air pollution and health, but also investigating the influence of spatially correlated confounding or modifying factors such as noise, the availability of green space, socioeconomic status. Those studies are also in the review process. We have 2 studies that are looking at the emissions of non-tailpipe emissions. One study is evaluating the short-term respiratory health effects in non-smoking adults with mild to moderate asthma, looking at after exercise in 3 different locations. One location representing brake wear, another tire wear, and a control location. The second study is actually looking to provide real-world field measurements to estimate and understand population exposure to tailpipe versus non-tailpipe PM. Last year, we talked about the traffic review that Elena also mentioned. Out of that, there were a number of recommendations for conducting research. We issued an RFA, and we have now, under that RFA, funded 4 new studies. One will be linking several models to create a framework for full chain assessment of transportation systems and the impact on health of the trap. Another will be examining associations of traffic-related air pollution between basically biomarkers and incident cardiovascular disease events. A third is looking at assessing the impacts of future urban transportation landscapes on cardiometabolic health using novel modeling approaches. And a 4th one, looking at developing models relevant to characterizing exposures to vehicle, rail, aircraft sources and relate those exposures to and understand the relationship to birth outcomes. The last thing I'll mention is a project we're just beginning. It's the heavy duty, we're referring to it as the heavy duty vehicle impact analysis. Why are we doing this? Well, we know that there can be substantial improvements that can happen if you institute sort of the new technology for heavy-duty diesel engines. Almost half of the fleet, however, is not using that newer technology and don't meet the newest standards. And a lot of these older vehicles are in urban areas and in areas of historically marginalized communities. And there's an opportunity to investigate these exposures and what are the potential health benefits. So we just recently issued an RFQ, a request for qualifications to answer this very specific question. What are the potential impacts? What are the potential emissions, air quality, human exposure, and health benefits that could be achieved by replacing this older fleet? So we're focusing on potential near-term impacts. So the 3 aims in this is 1, to identify a hotspot, 2, to quantify those benefits, and 3, we have an engagement piece that I think will be quite important for informing policy, is talking to vehicle owners and operators and communities about what are the potential challenges associated with doing that sort of replacement. And now I'm going to turn it over to our lead of our environmental justice program, Anna Rosofsky.
Hi everyone, thanks for being here. So I'm going to talk about our environmental justice program, which really took off this year. So the mission of the program is to facilitate, support, and fund scientific research, special project, and research translation to advance environmental justice for historically marginalized communities in the United States. And a lot of the work that we've done over the past year was informed by a workshop that we held in October 2022 with various groups in the EJ world. And so we have our EJ program, and it's governed by 2 groups, the Advisory Council and the Oversight Panel. Many of those members are here today. Please say hi to them. So our Advisory Council provides strategic advice. They ensure that the program achieves its mission and advises HEI in integrating environmental justice considerations into all of its programs. We also have the Oversight Panel, and they work similarly to our Core Research Committee or the Energy Research Committee. They define research needs and requests for applications. They select and oversee studies for funding, and they provide oversight and feedback while the studies are ongoing. So we released 2 requests for applications in the last year. The first RFA was RFA 23.2, and the objective of that RFA was to evaluate action programs and other interventions in the United States. It was an accountability RFA focused on historically marginalized communities. So the board just approved the 3 studies under that RFA for funding, and so we'll announce those studies in shortly. The other RFA that we released is focused on cumulative impact assessment. And the objective of this RFA was to strengthen community academic partnerships, develop tools, and conduct dissemination activities designed to improve health and uptake of research for decision making. The other objectives was to conduct cumulative impact assessment where results would be incorporated into a specific decision making context. And this was a new format for the type of RFA that HEI typically releases. The research is going to be led by 2 PIs, one representing a research institute and one representing a community-based organization. And there are 2 tracks, and by the way, the applications are still open for this RFA, so if you are interested, please apply. Intents to apply are due for track 2 today. So track 1 is a multi-phase track. It's a single application, and the first phase of that track is partnership strengthening and formulation. So it's specific support to strengthen community groups and academic partnerships that haven't typically worked together in the past, but need time to really formulate their research questions and identify environmental health problems in the communities. And then they will then move on to phase 2, which is actually implementing the research. For community-based organizations and research institutes that have worked together and have a history of working together, they can apply directly to this track 2, and that goes through a typical HEI preliminary and then full application process. And so here's where we are in the timeline of that RFA. We released the RFA, we had a well-attended applicant webinar, and track 2 applications are due on May 13th, and track 1 applications are due on June 18th, and again, intent to apply for track 2 are due today. So next I'm going to introduce Dr. Pallavi Pant, who leads our global program.
Good morning, everyone. Continuing on the theme of progress we've made, as most of you have heard by now in the last several conferences, we've been running the State of Global Air Initiative for several years. And for the past 2 years, I've kept saying we're going to come out with the next update very soon. So I'm very pleased to report that we are hard at work. And we will have the next annual level State of Global Air report based on the Global Burden of Disease 2021 estimates coming out next month. We are very excited about this report because this is the first time we are partnering with UNICEF. So the report will have a big focus on children's health impacts around the world. And we are hoping that this can help propel a lot of conversations around air quality action in many countries. In the meantime, we have been keeping busy by producing other resources. Elena mentioned briefly a video that we launched earlier this month. One of my colleagues, Ada, will have that video available tomorrow, and we'll also be happy to walk you through the process and how people are already using it, so please go and meet her. She's also a key person in our State of Global Air project. So if you have questions about State of Global Air, she's a good person to find. One other thing we found over the years is that a lot of resources on air pollution and health tend to focus on English materials, and many countries and communities around the world are not using English. So over the last year, we've made a very deliberate effort to produce content and material on air pollution, its health impacts in a variety of languages. We're focusing on South Asia and East Africa as 2 regions where we are very actively involved. So we've prioritized Hindi and Swahili, and then we're also producing materials in French and Spanish just to reach many more people around the world. So I welcome you to check out our new and updated website. give us ideas on what else you would like to see on State of Global Air. And if you're interested in meeting people from around the world that are looking at air quality and health issues, please join us for our live stream series, which is on the 7th of every month. And in May, on May 7th, we will actually be talking about environmental justice in the US. So if you're interested in that, please join us. Details are on our website. We are also continuing our work in South Asia. I've spoken before about a network that we've been supporting. That work is ongoing. We're very excited that we now also have 2 research studies designed to address questions related to cardiovascular health and maternal and neonatal health in India, led by investigators based in India, using data sets generated there. And continuing on the tradition of looking at policy effectiveness, or accountability as we call it, we've just started a project to think about what that kind of framework would look like in the Indian context, given that there are now a variety of policy initiatives trying to reduce air pollution in the country. So more to come on that. There will also be a poster at 10:30 if you want to know more about who we are working with. And then in East Africa, as I mentioned last year, for those of you who were here, we had just done a workshop to identify some priorities, areas where we can focus our work. And I'm very happy to report that we launched a review after that workshop to look at the available evidence on air pollution and health that has been generated within the region. We're working with an expert panel, including 6 people. 3 of the panelists are here, so please find them and talk to them if you want to learn more. You can also find Victor Enthusi, who's a staff member at HEI, and he is, again, a great resource for any questions related to this matter. In addition to that, as Elena mentioned earlier, we are keen on ensuring that we are reaching out, engaging, and communicating a lot of this information that already exists to people. So in a follow-up to our workshop last year, we did a 4-part webinar series that was co-led with institutions based in East Africa, and it was well attended. We are now also supporting an ongoing Africa-wide clean air partnership to ensure that health can be an important pillar within the air quality management conversations. And there's a lot more to come. If you want to know more about the scoping review, again, we have a poster at 10:30, so please come find us. Victor will be there to answer any of your questions, and I will be around as well. And I would now like to invite Dr. Donna Vorhees to talk about the energy program.
Good morning. Thanks, Pallavi. So the energy program, right now we are funding community exposure research in 4 major oil and gas producing regions of the U.S. I will describe them very, very briefly, but encourage you to go to the Energy and Health poster session tomorrow morning. There will be 11 posters there that describe what I've been talking about for years at these updates. I've been talking about studies. There will be actual results in these posters. So please do join us. But I do want to talk about the why we're funding this. And the why is that a lot of the people in this room, from government and from industry and from NGOs and communities and beyond this room, asked us to provide science that would explain what are people exposed to and where is the exposure coming from exactly. Because with that information, you now know what you can do about an exposure that might be a potential concern for these communities. So that's what we've been busy doing. That is the why. The 11 posters you'll see, they are not 11 conceptually disconnected studies. They are all directed at answering those questions. What are the exposures and what exactly are they coming from? All the while being done with engaging with local communities, initial steps in each of the study locations. And also, I mean, you've heard this phrase helicopter science, and it's hard to avoid that in some cases, but one thing that we are working very hard to do is throughout the research process, reach out to people in the local study areas who would use this information. So I'm gonna mention 2 people particularly because they're here today. One of our researchers, Gunnar is working with a community group who's helping with the passive monitoring in one of our study locations and keeping them informed throughout. We have somebody from the New Mexico Environment Department here today, Bruce Basil, who has expressed interest in some of the monitoring data that's being collected in the Permian region of Texas. So we're doing our best to not only get the science right, but get it into the hands of people who can use it constructively. The details, I'll be quick. 2 studies are finished related to water quality related exposures. They're both under review. One of them, Dr. Baga's study, will continue on for a bit. They're going to be evaluating the source apportionment modeling they've done with collection of residential drinking water data over the next few months. We've also been monitoring or funding research about exposures to air emissions and noise. We got a lot of great applications. The 3 best, we forced them into a collaboration. I think forced is the right word, done over Zoom screens, and to their credit, they have been working together beautifully and with great results that you'll see tomorrow morning. Conducting air quality monitoring over the life cycle of a well, trying to understand exposures over time and in varying distances from the wells. Also putting together what we're calling the tracer model to measure emissions and exposure to both changes in local and regional air quality. So those are all underway. The monitoring is telling us about exposure today. The modeling is a tool to understand exposure over time. We know that this is an evolving industry. The operations themselves are changing, the regulation is changing, and so those changes can be incorporated into the model. I'll give one example that you'll hear from Dr. Khaled. He's looked at how emissions vary depending on the drilling mud chemistry involved. So that's just one example. We have 4 new studies that are starting, and they all have posters so you can read about their plans. 4 studies in response to RFQs released last fall to look at air quality trends in oil and gas regions, and then to look very specifically in the Marcellus region, modeling the impact of spills. And this is a direct follow-on to Dr. Baca's work. We also have a couple of special projects underway. Yasmin Ramidi of our staff is leading our design of a cumulative impact assessment for an oil and gas community. The project has 3 primary objectives. First of all, we all want to advance the methods, cumulative impact assessment methods, and there's a lot of work going on. We want to do our part with what we've learned about oil and gas to help advance those methods. 2, we want to figure out, and this is challenging, what are the key factors, both beneficial and adverse, that need to be considered in a cumulative impact assessment to be sure to protect communities living and affected by oil and gas. And 3, look at the future with the energy transition and think about all of the future energy communities. Let's learn from the past. Let's use what we've learned about oil and gas, and hopefully to the benefit of these future energy communities. So I encourage you to talk to Dr. Ramidi. She's been working hard on this, on an educational webinar series. Next one is May 17th, and a workshop to discuss the draft design that will happen in winter, later this winter. Another special project led by Dr. Chloe Danforth of our staff is a research planning workshop on community exposure to produced water. Produced water is wastewater from the oil and gas industry, and this is planned for later this summer. And I didn't credit her. I am not an artist, so Ayusha Ariana made this lovely graphic describing ways that people might be exposed to produced water. Now, when I first talked about this program, a lot of this was theoretical, not the spills per se, but the use of it outside the oil field was more theoretical. Today, in water-stressed regions of the U.S., there is increasing pressure to use the produced water outside the oil field for irrigation, for road treatment, for a whole variety of uses. And so the purpose of the workshop is to understand how might people be exposed. Is there research that HEI should be doing in this realm? And I'll just finish with 2 more slides. A lot of outreach going on. We continue with community open houses, both in person and virtual. If you've been to the Permian region of Texas and New Mexico, it's big. It's hard for people to drive, so we've done virtual. Happy to brief you on this. We have online quarterly research updates on all our studies in English and Spanish. And if you don't get through all the poster sessions tomorrow morning, we will be recording them and posting those recordings to our website. Broader outreach, we continue our energy literature hub. You can click on your state and see what's going on with oil and gas research. Also, planning is underway to expand the literature hub to include a number of energy transition topics. And we periodically take what we learn and turn it into the webinars as part of our Energy and Health webinar series, or research briefs or reports. So if you have a favorite topic that you wish we'll cover, feel free to stop me and let me know. And with that, I'm going to turn it back over to Ellen, who's going to begin describing our strategic research plan, the draft.
So now we're going to start looking to the future. And just a little bit of background about how we got to where we are. So we actually started this planning process basically after last year's conference. So staff started meeting, talking internally, developing scoping documents, and then we started talking over the summer and fall to the sponsors, to our committees, all of our committees, outside experts, and here we are today with a draft strategic plan that I'm sure everyone has read from front to cover and is ready to discuss. So what happens after this conference? Well, we're going to take all the input that we get from all the participants here, all our committees, and refine and revise this plan so that next year, when you come to the annual conference, you will see the final plan. So that is the process. And if you have any questions or any concerns about how I submit comments, just talk to any of us and we will help you with that. So how do we start thinking about this plan, the context of the world we live in, where we're going to be 5 years from now, what should we be thinking about? Of course, one of the things, it's not even it's the no-brainer. It's well, we're thinking about climate change. We're thinking about the energy transition. We're thinking about new transportation technologies, and also this renewed effort and interest around addressing these environmental inequities. There's also, we felt last year, we heard very strongly from our sponsors, and we've heard along the way, of broadening our scope and our funder base. So I'm just going to hit some highlights here. These aren't all the things that are in the strategic plan, but for the Environment and Health Program, one of the things I want to emphasize is we're building on what we do well. We're not moving away. We're not stepping away from these things that we've done really well over the years. So clearly one of the themes for this area is transportation and health. One of the things that we do well, I think, and is very much valued is our accountability research. So we will continue to look at the effectiveness of policies that are directed at curbing emissions for transportation-related air pollution, but also thinking about other policies that might impact that are not directly aimed at that, like policies, the climate change policies. We're going to continue to look at non-tailpipe emissions. You saw, I mentioned, we have 2 studies going on now, but this is obviously an area of interest given the move to electric vehicles. The legacy fleet, you see the project that we're starting now on the diesel vehicles, and that we're thinking about the change and what these changes mean to the vehicle fleet, both for air pollution exposures and the health outcomes. Now we're thinking about broadening, going and looking at different places that we haven't normally been, and looking at the assessment of air pollution and the health effects associated with transportation hubs, things ports, rail yards, airports, and goods distribution centers. And then thinking about alternative fuels, how to compare these fuels that are and options that we have. And this area really emphasizes the integration of our programs, because we can't talk about just the use of these fuels. We also have to think about the production of these fuels, which ties us to the energy program and illustrates the integration at HEI. Another area, of course, is also not pretty obvious, is this air quality, climate, and health area. There's the changing climate. How is that affecting the air pollution exposures? And an example of a topic in this area is looking at investigating the role of air pollution in heat-related mortality and morbidity. Wildland fires, we have mentioned earlier, this connects to our discussions yesterday and to studies we have ongoing right now. This is going to become even more important, looking at the health effects of short and long-term exposures to ambient smoke. And one thing that Sarah brought up yesterday about this, these are no longer just exceptional events. What does it mean with these repeated exposures along the way, and how does this compare to sort of the low-level exposures? Ozone's going to also become an important area, looking at the assessment of those health effects of ground level ozone and the interaction with other pollutants. Sand and dust storms, we talked about this yesterday, and the effects of short and long-term exposure there, and long-range transport. Again, accountability comes into this area. A little different in some ways than some of just the accountability work we've done, looking at the assessment of effectiveness of these adaptation and mitigation measures, air quality indices, high heat communications, early warning systems. How do these help reduce exposures to air pollutants and acute events? Multi-pollutant mixtures, we've talked about this. We've funded research in this area, thinking about developing modeling approaches to improve these estimates of the impacts of these mixtures, looking at improving to the exposure assessment methods. Again, the particulate matter and the changing nature, this also connects back with the theme I just mentioned with climate change. Also, again, broadening out and talking about and expanding our work that Donna had mentioned and Anna also mentioned about cumulative impacts and thinking about identifying those key factors. How can we focus the research and not lose credibility with the results that we obtain? Toxic air pollutants, thinking about things that, we focus a lot on criteria air pollutants, but moving beyond that as well for both things that are well understood and not. And then continuing the great work that's been going on here at HEI, reducing environmental inequities. Again, thinking about method development, methods to assess all these chemical and non-chemical stressors at high resolution, thinking about these contributing factors, again, trying to identify things that can be changed. And one of the things that we heard at the workshop that Anna mentioned was moving beyond this description of the problem and trying to identify solutions, really focusing on that. Again, accountability. A lot of investments are being made. Are they having the effect that they are trying to achieve? And in this area, as well as in the other areas, thinking about resources and tools, what are the things that need to be developed to help the decision-making that's taking place? And all of this research, and the research even that I've mentioned before, involves this level of community engagement and a spectrum of community engagement. And I think with that, I'm turning it back to Pallavi.
So I just talked about all of the work that we've been doing as part of the State of Global Air initiative, and that has been a keystone piece within our global program as it has grown over the years. We've seen the program also produce resources in partnership with IHME and others that have really changed the narrative and the conversation around air pollution and its importance. We think over the next 5 years, there will continue to be a need for that, given that many countries are, trying to get on their air quality management sort of pathway. They're trying to figure out what to do. So over the course of the next several years, we hope to continue supporting and growing the State of Global Air initiative, identifying areas where we can highlight new data, new evidence, and new information, support the generation of evidence that can feed into the processes that are used for assessments like global burden of disease, and then finally ensure that we're producing materials that people can use in languages they can use, in formats they can use, and with the information that is most relevant for what they are trying to achieve where they live and where they work. That will mean resources, trainings, engagement with our regional partners and organizations. I'm very glad that we are starting to see a greater representation of those groups even in this conference. So thank you to all of you who are here and working with us. But in order to drive those types of assessments and information, we need research generation and synthesis of what we already know. Continuing on from the amazing work that the Environment and Health Program has done over the last 40 years, we are hoping that we can take some of those threads into low and middle income countries and identify what is the biggest question that that country, that region is trying to answer. In many instances, countries are implementing policies, so they're thinking about, what benefit is this bringing to my community? What benefit is it going to bring if I invest this money and time and resources? So we hope to look at accountability as a growing piece of work that the global program can also begin to do. It's pretty hard to do it here in the US, so I imagine it will be much harder when we start thinking about it in other regions, but we are hoping that's an area we will go into. Talking about high air pollution levels, often the first question you get is, so what do I do about it? What are the sources I need to address? We've done some work in the current strategic plan to address that at the global scale. We hope to continue that. And then also, climate change is not a problem unique to a particular country. It's at the global scale. And in fact, in the global south, it is impacting populations at a much larger scale already, given the vulnerabilities that exist. So we are hoping that the research that we do in our environment and health program can also complement work that we do in LMICs. And finally, as we grow our work around environmental inequities and environmental justice in the US, we want to bring strands of that into the work we do, again, globally and in the specific geographies where we work. But a hallmark of the work we've done globally has been strengthening capacity. So we want to do all of this research generation and synthesis with partners in countries where we are working. As I mentioned, we are currently active in South Asia and East Africa. We have staff members there. We have partnerships ongoing. And we hope to continue that over the next several years. But we also want to build out more research opportunities for people in those regions. We have a very successful Rosenberg program that has funded exceptional scientists. So we want to do something similar that now focuses on low and middle income countries. We want to ensure that the cutting edge methods and science are being accessed the same way by early career researchers that are based in LMICs. So thinking about resources, tools, trainings that we can build and continue over time. So I would welcome any suggestions from all of you on things that you may be doing, things that have worked, things that have not worked and should not be tried again. And finally, keeping in mind that there's now a lot of innovation and action happening in LMICs that can be very useful for other LMIC countries. So looking at opportunities to build more South-South exchanges, identifying opportunity areas, identifying pilots that worked in one place, bringing them to another place, and doing all of that, keeping the health as a central pillar of any air quality conversation, science, decision-making that happens. So I welcome any and all ideas from all of you. And once again, thanks to all of you in the room who've been really an integral part of making this happen and making it a bigger part of what HEI does. I would now like to invite Donna to talk about energy.
I second Pallavi's last sentiment very, very strongly. The energy transition is upon us, and there's so much work we could do to help inform good decision making. At the same time, all projections point toward oil and gas development continuing for quite some time. And so for that reason, we are proposing to continue some of the research that's been started on this early phase, and specifically some of the exposure modeling work and monitoring. I mentioned the tracer model earlier. It has quite a few potential applications. It's a model, so it has its uncertainties too, but it has a lot of applications, both for understanding exposures, both locally and regionally, but also, again, for being modified and checking what is the impact of changes to operations to reduce emissions, for example, in greenhouse gases, right? What do we see in terms of reduced emissions? What do we see in terms of potential health effects and health improvements? We also, the continuation of monitoring air toxics is important, and we could be using this monitoring to evaluate the success of some of EPA's work and some of EPA's regulatory actions. We've been asked about the noise monitoring, and we've yet to see all the results, but on the table is understanding health risk from noise. We've also been asked repeatedly about abandoned wells. There are millions of them, as far as we know. We don't know where they all are. We've been asked about both the emissions from them today and also with a lot of funding to plug them, problems that might arise by rushing that process and actually creating a problem where one didn't already exist. So we're looking at that. And wastewater use or produced water use, I already described our workshop, but this is really all around how people might be exposed to what's happening today. Today, there are permitted discharges under the Clean Water Act to surface water. But in the future, and now being evaluated today in some states, use outside the oil field. Staying with oil and gas, but a much broadening the scope, thinking more broadly about the oil and gas supply chain. And now we're talking about the infrastructure and the refineries and the cracker plants. And this is really important because there are community concerns here too, and this also crosses over into some of the work of Anna's work in the EJ program. And it also crosses over into the work of cumulative impact assessment, where people live in communities where they're affected by all of this. This is a huge area, so welcome your thoughts on how we narrow or where we focus, right? This is kind of the laundry list, and we're trying to understand where we can provide the most value with the research. Oh, sorry, health risk. So again, the tracer model has utility here too. There's a lot of epidemiology literature on oil and gas. A lot of it is based on distance metrics. In other words, how far somebody lives from a well. Some of it's based on the production levels of a well. But very few try to figure out what is it? What is the exposure that led to the health impact? So this model is ripe for use, or we hope will soon be ripe for use in that kind of an investigation. We've heard lots of interest in developing methods around incorporating local knowledge, indigenous knowledge into the research we do. This is very important for energy, where a lot of it's happening on tribal lands. So we hope to work to do that. Commonality across programs, accountability, accountability, accountability. And again, the model can be helpful here as well, but that's not the only form of research we could do. Again, I'm mentioning the EPA's methane rule, but this is something else where we could monitor and check and see, is the anticipated benefit achieved? And not just for methane, right? Because methane's emitted along with chemicals of concern for health, so we want to be looking at those. Cumulative impacts, you're going to hear it a lot. It's ambitious, but we really want to make headway here in improving methodologies and improving the lives of people who are carrying a burden, frankly, of multiple sources of exposure. The energy transition, last slide. Okay, so there are a couple of logical extensions of what we're already doing. You've heard about hydrogen hubs that are being proposed. Some of those are sourced from methane, so they're sort of a logical extension of the work that we've already done to date. Same with geothermal energy. You've got the drilling and the hydraulic fracturing and the produced water, so another logical place for us to go. Carbon capture can be a part of a lot of things, a lot of heavy industry, reducing emissions from steel and cement, but can also be part of hydrogen hubs. So we see these as sort of logical extensions to the work that we've done. Varying challenges here, right? Some of these things are happening today in the US, but a lot of it's not happening yet, so we cannot do empirical research, for example, on a hydrogen hub. They just don't exist yet. So they're on the radar. What exactly we can do with them, how far we can go, is a question. Ellen mentioned alternative fuels, and this is definitely a place where the programs, we seek to complement one another and fund complementary research. And on this, a part of this particular topic, I encourage you to join us for our 1:30 session because we're going to have a great speaker on this very topic. And finally, electrification in the battery value chain. This, like the oil and gas value chain, is huge. It's so big. And so really welcome your advice on where we could provide the most value. Certainly in the battery value chain, there are efforts underway to extract lithium, right, from produced water. So that's a logical thing that we can do. Do we fund research on mining operations? You know, how far back do we go in the value chain? So really interested to hear what you think about that as well. And then for all of this, none of us can predict the future. It's really complex. There are a lot of actors. There's evolving technology, politics, all of it combined. We can't predict the future. But we are talking internally about working on a framework for comparing the health risks and benefits across our various energy choices. So we're beginning to discuss a convening to develop a decision analytic framework to help guide us as we move forward. Hopefully guide all of us, writ large society, also guide HEI's research planning. And with that, I will turn it over to Elena. Thank you.
Thank you, everybody. I mean, I feel like hopefully that energy and enthusiasm for the work that has being proposed is being shared because I think it's just incredible the the breadth and depth of the topics here. As a part of the brain trust of the organization, we'd love to hear from you all what your thoughts are about the initial strategic plan and thinking about how we can do the best that we can in terms of bringing this work to life over the next 5 years. So we're going to open it up for questions, and just love to hear your thoughts on the plan. We have actually 2 microphones, one over here, one here, so feel free to ask any questions.
We have our paper and pen ready. Yeah.
Well, I guess I'll start.
How did I know? Chad, okay.
I waited to see if anybody else would
He
be
did
there. This is Chad Bailey from EPA's Office of Transportation and Air Quality. You mentioned early on, in addition to the content here, you also talked about potentially broadening the sponsor base. I'm wondering about what conversations you've had there.
Yeah, I mean, we've had a lot of conversations about sponsor base. I think, from my perspective, and I'll let others weigh in, but, I feel like this work is broadly appealing. I think this is something that, many across the private sector, for example, would be interested in. I'll mention that we have Nicola Shobot here, who's our new development director, who's also going to be helping us to reach out to potential sponsors and other funders, philanthropies. I think there's a lot of opportunity to try to secure resources to conduct the work that we shared here. I don't know if anyone, do you all want to make a comment?
Yes to all of that. Yeah, so we've been talking with various industry groups who are working in some of these new and emerging areas. We have been talking with federal agencies who are working in these areas. We've actually applied for funding from another federal agency to advance our work in these areas. And also, as Elena mentioned, philanthropy. There are a number of philanthropies particularly interested in the energy transition and a just energy future. So we've been talking with them as well.
Yeah, I guess one fine point on that is that, we are cognizant of the balanced funding, and so, we want to maintain that. We believe that this is a model that needs to be supported across all the different sectors, and so continuing to ensure that we have participation from, the breadth and depth of sponsors that we have. So we'll go over here.
Hello, Inarelli Morales, Weld County in Colorado. This is my first time attending the conference, and so far it's great. And so I'm just learning about the Institute, but has there, or do you plan to maybe work directly with policymakers? Or at least in Colorado, we have so many regulations that are just constantly coming out, and it would be great to have these accountability studies. But how to do those, I guess, in parallel, or how to work together, I guess, to decide which regulations we should focus on studying, or does that make sense?
Just a follow-up, are you thinking more specifically about oil and gas regulations?
We have oil and gas regulations. Okay. We have industry greenhouse gas regulations. I'm sure we'll have more when our legislative session ends.
Yeah. Well, Donna, you want to take that one?
Absolutely. So I think I said with community engagement, we're starting, but there's always more you can do. So first of all, please come talk to me, and I'm happy to talk with you about what we're doing now and involve you. I will tell you that we and also our investigators in Colorado, Dr. Collette's here, we briefed Colorado Department of Public Health and Environment. I forget the new name of the Colorado Oil and Gas Conservation Commission, but whatever the new name is.
ECMC.
Thank you. Air Quality Control Commission. We actually have an ex-CDPHE member on our board of directors. So she's been weighing in. And we've also had community open houses. We've had 2 in Colorado. And Weld County, I believe, I'll check. I think there was somebody from Weld County at one of them, but yeah, so we're trying to reach as broadly as we can. We had a lot of county officials at the last open house. So we would, and there'll be more. We're going to host another one probably later this year or early next year, so you're more than welcome. But please come talk to me. I would love your advice on where else we could reach out so we capture more people and involve you in what we're doing.
Thank you.
And I also like to highlight that we actually have a former Colorado regulator who's on our HEI board, so Martha Rudolph, and I'm sure she would be happy to talk as well about how we're working to share the information about the research that we're doing with policy and decision makers. So we'll go over here.
Hi everyone, Desiree Narvaez, UNICEF. First, congratulations to the HEI for the accomplishments thus far and also for the upcoming strategic plan. UNICEF is indeed pleased to partner with the HEI for the SOGA 2024 report, given that children are the most vulnerable population. So we think that the messaging, the highlights of the report will really make an impact on the ground. As you may know, UNICEF is working in 190, or we are present in almost 190 countries and territories. So whatever data and evidence we could give to the local governments will hopefully be translated into policy and action. So I think, and on the strat plan, thanks for this, I think on the research agenda, it looks like accountability is the overarching theme across all the themes and across all the priorities. I agree with Greg yesterday that, in fact, aside from the effectiveness of the policies, I think we need to have more research on operational implementation research, sort of, on the effectiveness of interventions. And by that, I mean effectiveness of risk communication, effectiveness of the awareness raising, and also on the technical capacity building on the ground. And even if countries have policies and legislation, what about the enforcement? So I think if we can go more into the effectiveness part of the interventions in addition to policies, that could make a difference on the ground.
Thank you for those comments. Does anyone want to respond to Anna?
Yeah, so I'll just say one thing about the accountability RFA that we released through the EJ program, which is that it asked for studies, applications that would assess effectiveness of policies, programs, interventions. So it is we shortened the text here just for the presentation, but we are also interested in assessing interventions. But your points about technical capacity building and implementation, we've heard that a few times through our discussions of strategic planning, so it's helpful to hear that from you as well.
Pat?
Morning. Pat Kinney from BU. I really enjoyed this morning session. This comment is for, I guess, Donna on this last slide. I was surprised not to see geoengineering of the atmosphere as another thing where people are suggesting injecting aerosols. Is that something that HEI might want to at least keep track of?
Duly noted. I don't think I can single-handedly commit HEI, but I added it to the list. Thank you, Pat.
Yes.
Hi, Mike Lehman, UC Davis. We heard yesterday that cost, effectiveness is a huge consideration in developing countries, and I think it's also a huge consideration still here in the U.S. I mean, a lot of the political arguments that you hear against sort of new movements towards cleaner air all stem from cost, and this is going to wreck the economy. But I didn't hear a lot from you about trying to work an economic analysis into this as well, to try to make an argument for what are the most cost-effective measures. And so could you speak to that a little bit?
Yeah, well, I'll mention one thing. I mean, obviously, economic considerations have come up actually a number of times in the research and review committees as some additional expertise that would be valuable to add to those committees for the very reason that you mentioned. So I think that is it's certainly something that we've been thinking about and trying to figure out how to incorporate that. On the regulatory side, I mean, as you know, many of the regulations are, legally not allowed to incorporate cost into the rulemaking. So I think that obviously is also a consideration. So thinking about sort of the reality on the ground, I mean, fundamentally, I think many of these roles end up being challenged on the basis of the economics. So yes, definitely something that we're thinking about. I don't know if anyone wants to provide some. Donna? Okay.
One little nugget. So again, Dr. Remitti's working on the cumulative impact project, but part of that, we're wrestling with that as part of this, right? How many factors do you consider? Don't look alarmed. You know we're thinking about this. You know, I didn't mention, but the project is being led by a social scientist. She's a expert on energy communities, and that includes she's not an economist, but it includes economics to some extent, and has referred us to, and we're starting to talk with people who are familiar with local economies and how might we incorporate that into that assessment. So we're starting to explore that. The connection is obvious, so we're starting to explore that as well, at least in this one initial way.
Brian?
Yeah, Brian Noble, EPA. So first, it's great to see this. This is a lot of really great new and continuing work, and I think it's going to be really powerful. One thing on the environmental justice side of things, and I know you're thinking about this, but I think it's really important to not just box environmental justice into one thread, that it really does need to be considered as you're developing all the other threads as well. So finding those ways to take your learnings from your environmental justice piece and bring that into the other studies, really encourage you to do that. I also think it's really important, I was really happy to hear the discussion about effectiveness of interventions, and I think it's really important to wrestle with the questions of how do we actually think about and conceptualize effectiveness when we're thinking about cumulative impacts, climate change impacts, et cetera, because we don't really have a fully defined set of effectiveness metrics that we can use that go beyond simply a change in air quality or a change in exposure, but looks at instead the entire well-being of a community or the entire set of impacts across different organizational and institutional actors. So it's really important, I think, to take some time to do that, and you all are really well positioned to do some convenings around that, about what does it mean to be a well-adapted, resilient community, and how does that adaptation get measured, and how does that resilience get measured, both right now but over time as well. So I think there's some real opportunities for HEI to be a leader in that. So just thank you.
No, that's a great comment.
Hello there. My name is Laura Myers. I'm a lung doc at Kaiser Permanente, Northern California. This is my first trip to HEI, so this was a very helpful overview about kind of where HEI has come and where it's going. I just had one question, and that was, you mentioned the State of the Air report, and I'm curious because there are various organizations doing kind of State of the Air reports, such as American Lung Association or American Thoracic Society. And I'm curious, in some ways I could imagine actually independent observations is helpful, because if various people are doing it, coming up with the same answer, that kind of bolsters the results. At the same time, I worry there's maybe duplication of efforts. And obviously, you know, research funding is tight. That could be going to other projects. So I'm just curious. I'm sure there's certain aspects of each report that are unique, but I wonder kind of the added value.
Yeah, well, Pallavi, and actually, do you mind also talking a little bit about just some of the differences between global burden of disease versus WHO and their guidelines and so forth?
Yeah, thank you for that question and also that observation. So I'll start by saying that the State of the Air report, which the American Lung Association has put out for over 2 decades, was the inspiration behind the State of the Global Air report, which we've now put out for 5 years. So we are not trying to duplicate what others are doing, and the report you talked about is US focused, so they look at you know, states and counties across the country, and you know, we literally took inspiration from it, starting from the name. So we just went to State of Global Air, looking at countries around the world. So we're trying to take that same principle but apply it at the global scale. And in the initial stages of developing State of Global Air, this was before I even joined, I know there was a very close partnership with the Lung Association to make sure we can utilize this. And I would also emphasize very broadly that in the work that we are doing, both in the US but also in other parts of the world, we try and take every effort to not replicate what others are doing, but find opportunities to build on it or complement it. So I think this is another really good reminder from you, and making sure that you know, we think about the larger picture and not just what the, you know, little piece HEI will bring. And as Elena mentioned, the State of Global Air reports rely on the global burden of disease data that some of you may be familiar with. It's a risk assessment framework that looks at a whole host of risk factors, over 80 in fact. Air pollution is but one of them. So we try and take the data on air pollution and make it more accessible to people. There are similar resources to that. The WHO, for instance, has occasionally put out similar burden of disease reports, but the last WHO report came out several years ago now. I think 2016 was the most recent version. So again, even in that arena, we are trying to find ways to bring those two, those two methods and data sets together, because we don't want people getting lost in smaller differences. We want to focus on the fact that, whether WHO did it or GBD did it, they came up with millions, and millions are a lot of people. So really useful reminder. Thank you for bringing that up.
Hi, my name's Lois Bauer Bjornson, and I'm with the Clean Air Council, and I live in Washington County, the most heavily fractured county in our state of Pennsylvania. And I really appreciate this. This is my first time to the conference. I'm an on-the-ground worker. I work in environmental justice communities every single day. One of the comments that I'd like to when you're working on the EJ communities, as the gentleman from the EPA said, of the ever-changing. For instance, in the state of Pennsylvania, they just redrew the environmental justice maps, but it excluded some people that were already in it. So we've had to, myself and my colleague, and other colleagues have had to advise our own DEP as to, like, wait, this map is wrong. So those are things that you may want to be aware of when you're looking into that. Don't always go by what the state is telling you. Look at the people that are on the ground. And Donna, to your fantastic information as far as having community members work, I'm here to tell you that we can introduce you to everyone in southwestern Pennsylvania that's on the ground. We'd be more than happy to help you. Dr. Baca is over here. She has done the groundwater studies. We've introduced her to numerous folks. And I think another thing that's going to be extremely difficult for all of you is focusing on one thing. It is like every day when I think, and I'm not a scientist, I fell into this work because I had to, that I think I've figured something out. There's one other thing. Washington County is slated for hydrogen hubs, possible hydrogen hubs. I can tell you I had a report out from Germany. They do it there. You can take a look at it there. The carbon capture we're slated for. We have the petrochemical hub an hour north next to my children's school, 20 minutes from East Palestine. So this is on and on and on. I'm not sure that you can actually, and I know it just puts so much more work on you, but we're here to help you. I don't know how you can focus on one thing, but thank you so much for your work.
Thank you.
I hope that was helpful, and I'd love to talk to all of you afterwards.
Well, just another plug for the RFP that's out for community groups specifically, because we do understand the value and the need for the work. So, we want to continue to support that as much as we can. Thank you for those comments.
Greg Evans from University of Toronto. This is fantastic work, and clearly a lot of very good thinking has gone into it. And I see many of the boxes I can think of have already been checked. One thing that I suspect you have thought about, but I just want to give you a chance to comment on it further, is developing better tools, practices for community-based research, how to set it up from the outset, what sort of methodologies for those of us who come from physical science and now are starting to immerse ourselves in the world of social science. I think if we can set up the projects from the outset more effectively, we will prevent some of the hurdles that we end up at the end stages when it comes to trying to actually implement action. So that was one thought. And the second theme that I heard was the pace of change. So the evolution is going quickly and it needs to go quicker still. And so that's created a new paradigm of, which is a bit different than the structure you have, where we do very rigorous research, we do a lot of review, and we get the dissemination afterwards. We need to move something closer to the learning while doing rather than learning by doing. So we need to be able to get the results out more quickly to inform the next study that's being done rather than have this sort of sequential approach. So I also want to encourage you to think about that as well. How can we increase the pace of this so that we can actually meet the pace that needs to be done? So
Yes.
Anyway, excellent work. Just want to put
Thank
those thoughts
you.
in.
Well, I'll just have Anna respond to some of the work on EJ.
Yeah, so thanks for that comment, and it's a really important point. Again, one of the goals of this RFA that's out right now is this phase one, which is supporting researchers such as yourself and others who are sort of new in the community-based research world, but want to help answer research questions that are of importance to communities. And so part of what we're going to do here is provide a lot of technical assistance, training where needed for those that have not been involved in community-based work in the past. But it is helpful to hear that it's a need, and that there are researchers that sort of want to be in the space meaningfully and effectively. So that's something that we'll continue discussing too.
Hi, Vikram Ravi from National Renewable Energy Lab in Colorado. So as a DOE national lab, we often look at the impacts or transitions of the energy system. And one of the things that comes up there is how can we look at, because the energy system transition, let's say between now and some future year, often happens in a phased manner. And that is going to yield cumulative benefits. So we talked about, you mentioned about cumulative impacts here. That is cumulative in terms of risks. But when thinking of the transition in any other space, those impacts or benefits are also going to be cumulative in time. So is there any consideration or thoughts on that and how that can evolve? Thank you.
Sure. Donna, you want to take that?
We're definitely thinking about both. So I went through my slides really fast, but on the cumulative impact project that we're working on now, we are thinking about both. And on the slides, and if you look in the plan on the energy transition section, I think pretty much everywhere it says benefits and risks, because if you really care about health, you need to think about the totality, right? So it's definitely part of the plan. Thank you.
Hi, Sean McNamara from Health Canada. Really great. I think you covered most of the main sources, but was curious to see some that weren't covered as well, right? More the ones I guess that are trickier to regulate, for example. Residential wood combustion in Canada is a big source of PM, for example. These types of sources I think are interesting. I'd be curious to see here. And in terms of accountability as well for these sort of harder to regulate areas, right, aside from the fuels, the oils and gases, these types of things. I think that'd be interesting to at least explore a little bit more. In terms of basic models as well, in terms of what works well for communicating outwards, I think there's not a whole lot of I've seen in terms of accountability studies that look at the effectiveness of the actual messaging that gets out. And I think that would be very helpful. Again, you guys do a lot of great work in this area. In terms of accountability for other organizations and guidance, I think that'd be very helpful for informing how they plan and communicate messaging, understanding that it's really a multi-stakeholder type of activity, right? We need everybody on board for it. And then marginalized populations, I know you guys talk a lot about it, but I don't really, it's sort of probably a catch-all for a lot of different groups, right? Low income, I think that's sort of how it's used here, but there's a lot of other high-risk groups as well that I'm not necessarily sure they're captured in the EJ. Or not, but definitely something that's top of mind for us as well. Older populations, younger youth, these things, and making sure the messaging gets out and that we really understand the exposure and what needs to be done.
Thank you for those comments, and I do think the communication piece is one element that we're trying to figure out how to incorporate in a more tangible way into the plan. And so, Ellen, do you want to just mention 1 minute? Talk about how we translate our work.
Yeah, well, actually, I was just going to mention the fact that, in part of the slide on climate that I showed, it talked about accountability and the messaging associated with that, of early warning systems, things like that. So it's trying to also bring in that as well as just one example of where bringing in the idea of looking at the accountability of messaging.
Hi there, Lucas Henneman, George Mason University. I have a question about how you're thinking about the project scales that you fund. So large-scale projects like national or like State of Global Air covers a lot of people and can be really informative for large-scale policies, but they don't necessarily incorporate the same local knowledge or community group engagement as small-scale studies. And it seems like the list you have, you could apply it to either of those, and they might have different impacts for both. So how do you consider, or how will you consider, what scales of studies to fund?
It's a great question. I mean, honestly, it's part of the sausage making of how we do the work. I mean, it depends on, what resources are available for a particular RFP. I mean, I think in our minds, we're thinking about, okay, I mean, part of it is that research has gotten more expensive over time, right? And so how do you provide the resources to be able to do the project in a thorough way and rigorous way? So I guess there's not sort of a explicit answer to that, other than we get a lot of guidance from the research and review committees, and actually Dr. Melissa Perry and Dr. David Savitz are here. They're chairs of our review and research committees respectively. So I'm sure they might be happy to talk a little bit about the thinking that goes behind determining, how studies are funded, and the thought process in terms of development of the RFPs. We do, before we release any RFP, we send that out to sponsors for their comments, and part of the comments that we're looking for in terms of feedback are these enough resources to kind of answer the question that's been posed? And so I think that's a critical piece of a successful, for us to be successful, is being able to do the work that has been proposed and that we're funded. So yeah, it's a great question. Yeah. Carol? Yeah.
Oh, sorry, I just wanted to elaborate. I think you said this, but I just elaborate on one point. So, one of the reasons we're talking to all of you, and we have had research planning workshops and whatnot, is because to answer your question, you need to know the context. Like, what is the policy decision we're trying to inform? And so that's the starting place for any request for applications that we would release. So what is the policy question we're trying to inform? And then working back from that, sort of, is the scale of the population one might need to consider to answer the question. The other factor that we don't control is the quality of the applications that comes in. And so, we're looking for the absolute best application. So to some extent, that might dictate the actual size of the population.
Yeah. Carol?
Carol Henry, I represent Cummins, a funding sponsor. My question really is, this is an enormous amount of work that you have proposed, and so what I haven't seen yet is what your thoughts are on criteria by which you're going to judge which studies, which things to emphasize, and which things you're not. And how, if you could be, when you finally kind of get to this, if you could be transparent about why you're doing some areas and why you're not going to do others. And that may be part of the issue of, you've discovered that somebody else is kind of working on some of these things, and so you don't think you have to have that quite as a priority. I think that's really going to be important to be able to focus your work, because I think this could occupy you for 50 years.
Yeah, more. I mean, this is a tremendous amount.
All right, so let me just follow on. I think one of you, or both of you, or several of you have said we can't predict the future. There used to be a committee at HEI on emerging technologies, and I think this would be a great opportunity for HEI to consider something like that, that included people from industry, people from government, and perhaps academia as well. But the new technologies that are being developed are coming rapidly, and none of us really know, but I think having such a committee would really help HEI look into the future and be prepared for some of the fast-paced changes. And so I would just strongly recommend that you consider reinstating. This is not the first time I've asked this, but it is the first time I've asked in public, so we'll see what happens. And I think that you would find an ability to expand to some of the non-traditional sponsors. I mean, an example is Tesla on your radar for being included as a sponsor, or what would the criteria be to have to include a company like Tesla or some others? And I think there's some other technology companies that would really be fascinating. So anyway, that's my 2 cents today.
Thank
Thanks.
you. Yes, thank you. David.
Hi, I'm David Savitz from Brown University and chair of the research committee. I was just going to go back briefly to Lucas's question, maybe a little bit about how the sausage factory works, at least from the research committee's perspective. And of course, the RFA has a ceiling amount. And what can happen is there will be projects that overreach, that propose something more ambitious than can possibly be done. That does not often go well. Or they're smaller projects that are padded to reach the maximum budget allowed, which we all do. It's okay, we got this much, well, let's throw some more things in. And I think there is a receptiveness to clever, efficient, smaller scale projects that are under the same theme, so that it doesn't, you know, again, obviously you want to ask for what you need, but it's really trying to make a meaningful contribution within the scale of what's possible and the scale of what's needed. So it's maybe it's circular in a sense. It's sort of ask for what you need, but to be open to the idea that that exact amount of the ceiling may not calibrate to what you had in mind. And if it's lower, that's great. If it's a lot bigger, you've got a problem and may have to figure out how to segment it, but not to overpromise either. So again, it's circular. Just get it sort of just right
Yes,
is the advice.
the Goldilocks approach. Yes, thank you. One more, Chad.
So, and maybe I shouldn't say this because Chris Frey is getting up, but so how, like, this is all HEI, but you know, I'm thinking of how ORD organizes itself. There's air, climate, and energy. There's sustainable and healthy communities. There's these other research programs. This is all HEI, but are we seeing 3 independent research areas or research programs? How do they interlink? How do they talk? How are they governed?
Sure. Ellen, you want to take that?
Me? Oh, great.
We'll give Ellen the tough ones.
No, so I mean, I wouldn't view them as completely, I mean, they have different funding sources. Right now, they have different committees that oversee the research and review. But we are all talking together, and that's in putting together this plan. We've talked a lot about how we can coordinate and connect and make sure everybody's aware of the research that's going on and how it can all complement each other and be integrated together. So, I mean, I would say that we are working more together probably than maybe we have in the past. It's been a really experience working and developing this plan together. So.
And actually, Chris.
Yeah,
do one more. Yeah.
I was thinking last year we had a session. I'm Chris Frey at EPA, by the way. We had a session reflecting back on the contributions of HEI in a number of areas, and I think that gives insight on the ingredients of what makes HEI's work impactful and successful. And I know a lot of that underlies what we've heard in the thoughts for the strategic plan. But just to kind of remind ourselves to look at that and make sure to distill lessons learned going into this strategic plan. I do think, I mean, it's a tremendous amount of information that and very ambitious. And it's hard to disagree with anything that came up on any of the slides. It's like every one of these is an important topic. Every one of these could be an RFA with 5 or 10 grants. And I think to Carol Henry's point about, you know, how will decisions be made to scale up or down depending on resource availability. And Chad, my colleague in EPA, you know, pointed out we have to do that in our office as well. So I don't think this is a new issue for HEI or any other research organization. But I think, you know, an essential ingredient of what HEI does is the quality and the relevance of the research it actually does. And so just making sure that whatever choices are made, that it still has that impact. And there was a comment earlier, which I appreciate, you know, the science and the interface between science and policy is challenging because the policy is often moving faster than the science. But we also have to be careful that the science that is delivered is not only credible, but trusted and doesn't backtrack. that'll be an important thing to navigate. So I think another theme I heard, and Brian mentioned about the learnings across different topics, is capacity building for the research community and for the science policy interface. And so I'm wondering if there's some generalizable things that cut across lots of topics that help us be more flexible to adapt to rapid change, even if it's not always possible to keep up with RFAs that address every single rapid change in real time, but that we develop the tools and processes and systems thinking that enables us to be adaptive. So that's a very vague thought, but and then I guess, I think in this session it did start with a statement of kind of foundational principles about what is the DNA of HEI, but I would just encourage sticking with that. And so thank you.
Thank you for those comments. Yeah. There's one quick question. Last one. Okay.
Thanks. I'm Margherita Tolotto. I'm coming from Brussels. I'm working in the European Environmental Bureau. It's a federation of environmental groups, around 180 from around Europe. I am extremely grateful for the opportunity for being here and listen to what you are sharing. I think it's very insightful for me. I'm mostly working on the end of pipe part where we try to translate science into policies and legislation. Maybe you have followed a bit what is happening in Europe at this stage. The agricultural lobby is really making its way on a lot of new legislations. What used to be defined in around a 2-year decision-making processes became an urgency procedure and got solved in 1.5 months. And this was the decision on how to spend around 40% of the European budget on agricultural support. And there is another legislation which didn't go into any impact assessment to change the nitrates level in the soil. And this is again to favor this urgency support for farmers. The agricultural sector in Europe is responsible for around 50% of PM2.5 emissions through the ammonia relationship. And I was wondering if you are planning to establish at some point any specific program focusing specifically on the contribution of the agricultural sector on air pollution in the US.
Yeah, that was mentioned actually in the slide. I went, as Donna mentioned, going over the slides quickly, but in the one slide there was about the changing PM, and one of the sources was ammonia that we're talking about. So I think that is one of the areas as well.
Yeah, thank you for that. All right, Mike promised to be very fast.
I supplied written comments yesterday as my review committee member, but two things. And this builds on what Brian was talking about, seeing the lens of environmental justice, but also I think, we have to recognize that we're in a climate crisis. That's what the United Nations calls it. That's what it's called in Europe. We still call it climate change in the US, but it has to be something that tempers everything that we do, I think, in air pollution and other sectors, energy transitions. So I encourage you to ensure that that's the groundstone of everything that HEI is doing from now on, because it really is a crisis, and we have to put a priority on it that I haven't seen so far from, I'm not singling out HEI, but other funding agencies as well. EPA has been doing a lot on this. I commend them for that, but NIH hasn't really been there. So I think it's a space that needs a lot more emphasis. And then secondly, partly because I don't understand the implications, but I'd really like to see some systematic review on the impacts of artificial intelligence on exposure science, environmental health, environmental epidemiology. And I saw a recent report by USAID, artificial intelligence and global health. I think HEI is well positioned to do that kind of review, to recruit the right experts, and to really synthesize what's known now and how we should be reacting to that, because it's going to be incredibly important.
Thank you. That's great comments. And thank you, everyone. I'm going to turn over to Dan. He's got a couple of announcements, and we really appreciate your feedback. And as we mentioned before, there's numerous opportunity to provide feedback on the strategic plan in a number of ways. Yes, and there is a QR code here. which will allow you to participate in a Jamboard, and then there's also a survey that you can complete as well. So anyway, lots of opportunity. Please, please send us your thoughts. Thanks so much, and here's Dan.